Hello and a very good day to all the Lybrate users. I'm Dr. Shobhit Bansal. I am a chest physician, which are also called as pulmonologist. That means I take care of your respiratory tract. Along with the diseases related to the respiratory tract, we also look after sleep and allergy disorders. So what I am dealing or talking today is the 6 cardinal symptoms of the respiratory system. 6 cardinal diseases of symptoms of the respiratory diseases. So and it is not so that these cardinal symptoms are present singly. These can overlap, and one should, whenever any of these cardinal symptoms is present or an overlap between these cardinal symptoms is present, then one should always consult a pulmonologist, since these cardinal symptoms reflect some or other form of the disease which are taking place in your respiratory system. So, since we are dealing in the respiratory system, first I would like to tell you a little bit about our respiratory system. It is divided into 2 parts, the upper airways and the lower airways. The upper airway or the upper part of the respiratory system starts from the tip of the nose and it goes up till the larynx, whereas the lower part of the respiratory tract starts from the larynx and it goes up till the lungs. All these symptoms, which are basically the 6 cardinal symptoms of the respiratory tract, could either be because of the abnormality in the upper airway or they could be present because of the abnormality in the lower airways. So what are these 6 cardinal symptoms for which you should always approach a pulmonologist, which is a chest physician? Number 1 is the cough. Cough yani ki khansi aana. Now we all know and we all see on the television also, and even big celebrities these days tell you about cough, and if the duration of cough is more than 15 days or so, then you should always visit a doctor. Now, but we should always know that what all could be the causes of cough, or is this cough really serious? Cough can arise from the upper airway or it can arise from the lower airway. If it arises from the upper airway, it could be the rhinitis, it could be the sinusitis, it could be either bronchitis or pharyngitis or laryngitis. But if it arises from the lower airway, then mostly there is pneumonia, tuberculosis, lower respiratory tract infection, or some other form of diseases including interstitial lung diseases likewise. So, and next, the cough could either be with the sputum production or it could be dry. When should we go to a doctor? Now, if somebody is having cough and he is taking warm water to drink, taking warm gargles, taking a little bit of cough suppressant, and if the cough does not go even after 3 days, then it is always better to approach a doctor. Why? Because there could be causes which could be a little serious. Maybe there is some underlying pneumonia or there could be some sinusitis which needs to be treated. So always keep in mind that if the cough is more than 3 days and it is having sputum production, or if it is not going despite taking mild medications, one or saline gargle, warm water to drink, steam inhalation, that means the home-based remedies, if the cough is not going, then one should definitely approach a chest physician. This is the first cardinal symptom. The second cardinal symptom is sputum production, yani ki balgam aana. Now, what happens is whenever a person develops cough, there is some underlying disease, and then along with the cough, the person also develops sputum, yani ki balgam aata hai. The production of sputum itself is not a serious disease, but if the sputum is foul smelling, if it is excessive in production, or if it is a discolored one, that means either it is yellow color or with a rusty tinge or with a reddish hue, then one should always consult a pulmonologist. What are the causes of sputum production? The first and the foremost cause is the pneumonia, which could either be a bacterial pneumonia or it could be a tubercular pneumonia. The other causes of sputum production includes malignancy, chronic bronchitis, and so forth. So we are done with 2. Now the third cardinal symptom of the respiratory tract is hemoptysis. Hemoptysis means coughing out of blood from the respiratory tract, yani ki khansi mein se khoon aana. Any form of blood coming out from the respiratory tract is always a serious condition, and one should always consult a pulmonologist. He may get a chest x-ray done, he may get some basic other investigations done to rule out few conditions which might produce blood from the sputum. And what are those conditions? Either it could be tuberculosis, either it could be trauma to the chest, or it could be malignancy. But there could be other causes as well. So any amount of blood, even if it is 1 ml, if it is coming out of the airways, one should always consult a pulmonologist. The fourth condition which requires immediate intervention, immediate attention is shortness of breath. If the person is feeling short of breath, that means normally we breathe, we do not feel as if we are breathing. But when a person is short of breath, he feels difficulty while breathing. It is a sort of a labored breathing. सांस लेने में दिक्कत होती है. So there are many conditions causing difficulty in breathing. Either it could be cardiac or it could be respiratory. As a pulmonary physician, we mainly work on respiratory conditions, which include chronic obstructive pulmonary diseases, asthma, interstitial lung diseases, pulmonary edema, and sometimes pneumonia can also cause shortness of breath. Any form of shortness of breath which occurs when a person do any exertional activity, any of the exertional activity, and if you are feeling short of breath, सांस फूलती है थोड़ा भी काम करने पे जो पहले से ज़्यादा है, then one should always approach a chest physician or a pulmonologist. The fourth cardinal symptom is production of wheeze. Wheeze is whistling sensation from the respiratory tract. सांस में से सीटी और किसी आवाज आना, जिसको हम wheeze कहते हैं. Most of the physicians and pulmonologists feel that if person wheezes, it is asthma, but there could be other condition also in which a person might produce wheeze, which includes interstitial lung diseases and other obstructive airway diseases like foreign body or tumor in the respiratory tract. So if a person is having wheeze and is facing difficulty while breathing, one should always approach a pulmonologist. The fifth condition which requires immediate intervention or is one of the cardinal symptom is the chest pain. Chest pain should always be taken seriously. Why a chest pain should be taken seriously? Because there are many conditions causing chest pain, but two types of chest pain need to be seriously taken. One which is a retrosternal, that means present in the middle of the chest and giving you a sharp stabbing feeling. Acute piercing pain, अगर बहुत जोरों से पेन है छाती में, तो that could be of cardiac etiology. You should always visit a cardiologist. But if it is a dull aching pain, दर्द हो रहा है, साइड में हो रहा है, महसूस हो रहा है भारी भारीपन, हल्का हल्का दर्द, it is a chest pain of pulmonary origin. For the chest pain of pulmonary origin, one should always visit a pulmonologist. What are the conditions causing chest pain of pulmonary origin? It is pneumonia, tuberculosis, malignancy, pleural effusion, and there are a lot of conditions causing chest pain of pulmonary origin. So we have talked about all these cardinal symptoms of the respiratory tract. Hope you people got aware with this and would definitely like to visit a pulmonologist. You can also consult me. I am a chest physician again, and I sit in the Pakshi Hospital, which is located in Sector 33, Noida. I am usually present from 6 p.m. till 9 p.m. daily, and Sundays morning 9 a.m. till 2 p.m. Thank you for watching. Hope you people got further aware with the respiratory conditions. Thank you.